Hello and welcome, and thank you for joining us for the 6th Annual Global Summit on Kidney Innovations, Vox Populi. The time is now to prevent and cure kidney diseases. This summit is hosted by the American Association of Kidney Patients in partnership with our allies from George Washington University School of Medicine and Health Sciences. My name is Dr. Barry Smith. I'm an AAKP board member from New York in the United States. I have a long history in kidney disease, was the head of the Rogerson Institute for more than a dozen years, and am committed to seeing to it that kidney disease is eliminated and that people with kidney disease are better taken care of. Being part of AAKP for about 20 years, I have learned to hear a lot of different voices about what kidney disease is and how it robs people of some of the important parts of life that are enjoyable. And we don't need that to happen. And much of kidney disease can be eliminated. And so we need to work on that. This year's Global Summit theme, Vox Populi, was purposely and strategically chosen by AAKP for its historical meaning, voice of the people. I am one of the people who have chosen to raise my voice in support of greater care choice and innovation in kidney care, and I am one of the voices demanding a change in status quo kidney medicine. Now, as you may know, over 850 million individuals across the world have kidney disease. This number is increasing at an estimated rate of 5 to 7% annually. Every year, we lose thousands of innocent lives to preventable kidney issues and the lack of timely access to treatment. AAKP believes kidney disease is both a workforce and a healthcare issue. This disease takes a devastating toll on human lives and livelihoods. Most people understand that kidney disease left undetected and untreated can lead to premature death. But many are not aware that it impacts a person's dignity and ability to provide for themselves and their families. Kidney disease and outdated treatments can lead to unemployment, underemployment, disability, and dependency. In 2019, AAKP declared the next 10 years the decade of the kidney. The time is now for kidney patient consumers, healthcare professionals, researchers, industry, and all people of goodwill to unite our voices and demand change. We are optimistic that we can and will save more lives, but to do this, we must demand new screening guidelines and diagnosis, new biologics, and new devices. Together, we can manage and solve this growing public health care crisis. The time is now for elected and appointed leaders worldwide to listen to patient voices. Governments must remove the regulatory and payment barriers they create that delay innovation and prevent timely care access. If government fails to act, we must raise our voices and demand an end to negative government determinants of health. Make no mistake, every nation is impacted by kidney disease and millions of people are at risk. The optimistic news is that every person watching this program today can help those impacted by kidney disease and make an impact within their own nation. Through AAKP Global, AAKP is educating patients, care partners, healthcare professionals, and policy leaders across the world on unmet patient needs. Our annual Global Summit on Kidney Disease Innovations has helped us put a human face on what is now the 10th leading cause of death based on data from the World Health Organization. We have connected people across the globe in a common purpose larger than any one purpose or nation, or one person or nation. Together, we have increased hope and optimism. So thank you for joining us. Your voice is the voice of the people, and you can count on AAKP to keep amplifying it throughout the world to create change. With that, I am honored to serve as the moderator for our session entitled Impacting Community Health with Global Implications. Now, our next speakers have been at the forefront of innovative healthcare initiatives in Brazil, working tirelessly to improve the well-being of their communities. Through their dedication and passion, they have made significant strides in addressing key kidney health issues and promoting overall wellness. We are eager to hear their insights and learn from their experiences. Please take it away.
Hello, I would like to thank you, Ms. Dr. Smith, AAKP, George Washington University, for having me here. It's really a pleasure being here for presenting Cedaps, which is a Brazilian NGO that is working in Brazil for 30 years now. We have a great motto that says, "We are here because reality doesn't change by its own." And I really want to explain to all of you what does it mean. So we started 30 years ago with the mission to promote the strengthening of communities and popular territories, youth and public services, contributing to the improvement of sustainable, inclusively, and health public policies. This means that we want to stay and to partner with those populations that have their rights most violated. If you pay attention on our values, you will see five main topics that guide all of our actions, projects, and programs. They say basically that participatory actions and partner with the most vulnerable communities are key to have good public policies and health policies that must include everybody and must be offered to all. It doesn't matter gender, race, and other characteristics of the population. During these 30 years, we have achieved great milestones. We are partnering with international agencies of the UN. We are influencing public policies in both their design and implementation. And by saying that, we just want to say that we are not the protagonists of any of those actions. We are partnering with local community, public services, and youth. It's really important to be clear since the beginning. So, as I said, it's important. It's really important for us. And I strongly believe for everybody that wants to work and implement participatory process to identify your partners, as we do here in Brazil and in Cedaps. We identify who is the protagonist of the action. It can be a service or it can be anyone else that is affected by a complex problem. So we work with a methodology called shared construction for local solutions. And we implement this methodology in any project we do here. And it says that where is the problem is where we can find the solution. We always work with local actions for health promotion. And we work with our local partner by doing. We are not just in theory. It's really important for us that what they idealize, what they design as their solution, they implement it just to check if it works or how can we improve it. And we are the one, I mean, Cedaps, responsible to systematize it, to create the experience and the background, to share and to disseminate the information with other communities that are probably struggling with the same problem and can be inspired to use the idea of other community by their own community. And by doing this, we are strengthening a network of young people, of public services, of community based organizations, and with everybody together. And it's also important to mention that we do not see them as a beneficiaries, as we usually use this term in social projects and in different places. We saw them as participants because they are not just the one that can be benefit by the action they are creating solutions. So these concepts are really important to be used and internalized in the day by day of the work, because by change the word, by changing the concept, we can change how we see people and how we really understand partnership. We were inspired 30 years ago in partnership with Dr. Smith by a methodology called problem solving for better health that you might know, and also by the popular education created by Paulo Freire, which is a very well known person here in Brazil and abroad. And our third inspiration is the health promotion principles. We designed this methodology combining these different concepts and mainly respecting the local culture, mailing, going into the territories with a very open mind and open listening to organize our work and not just stay in a conceptual way. We are organized in three different areas in Cedaps. The first one is public policies. The second is prevention and care. And the third one is youth. If you pay attention, those are the main publics or the main areas that I mentioned in our mission at the beginning of my presentation. In the public services, we mainly with the local health assistance. So we are at the basic health assistance, and we work with those that are in the day by day of the work. And we invite them in very different cities in Brazil to come together, and we provide them training, and they draw a map of the problems and of the potential solutions. And when we move forward after a while and after learning some concepts, they are designing the solutions for their unity, their health unit. How can they improve the services they are offering? How can they overcome some problem they have? For instance, how can they mobilize more youth to be part of the services they are offering? And by doing this, we are working with more than 30 municipalities in Brazil. This map presents where we are nowadays, and in each municipality of these, we work with 100% of the health units of the city. So, and we are doing this based on participatory process. on doing together, on designing solutions together and providing assistance on the implementation of those solutions. In the prevention and care area, the second area of Cedaps, we are working mainly with community based organizations. Since 2005, we have health community networks, which is a movement of community based organizations that come together to exchange experience, to learn with one another. And we have Cedaps as the one that's promoting these actions, promote meetings, trainings, providing sometimes financial resources for them. They are working mainly to build a collaborative and supportive groups and networks, community strategies for health prevention and promotion, and we also promote a political advocacy because we understand that's the way we will work together with public policies, with public managers, and help to improve the quality of the life of these people. We started this network in 2005, as I said, here in Rio, but nowadays we are in those states in Brazil. When I say we are, I don't mean that Cedaps is in these states, but the methodology is there. And we are providing information, systematization, and any type of cooperation that we can to spread this methodology in our country. In the health area, we are doing the same. Our main goal in the youth area, the third area of Cedaps, we are doing the same. The main goal of the youth area is to create economic opportunity to increase the years of study and to promote leadership amongst youth that don't work and don't study. What they usually call the needs, but in Cedaps we don't use this concept. We use just the youth. And what we do with them is to create solutions for their community. So we offer them a training course, and in the training course that's all based on shared construction for local solution, they bring out solutions for their community. In these pictures, you can see two examples. The first one is a group of youth that understood during the course what is the importance of a residence community, of the residence association. And by doing this, they understood that it was important to disseminate the information that in their community they have a resident association and what its role, how they could help the residents. So what they did is to painting the build that where is located the residents association, and they also put something that the residents could see where is the association. The second example, it was a group of students in our course that they identified by drawing the map where the oldest resident lived at that time in their community and how important this woman was for the group, how she was able to put all the group together and to feel and provide them the feeling that they were at home just because this woman was living there. And they said, her house that you can see in this picture was so ugly. We could try to improve her house and to paint, to bring her color. And they did so. And this is an example of participatory process of bring together the solution. So when we talk about a participatory process or health promotion, especially for health public policies, we think about three different dimensions. The first one is the social political dimension, when we recognize the importance of civil society for social control. They cannot just act by their own and understand that all the solution they need will be created by them. They are able to create it. But it's important to recognize the importance of public policies and health public policies. The second dimension is the social environmental dimension. It recognizes the social determinants of health to formation or to bring the vulnerabilities of that locality. How can we understand how vulnerable they are due to this health social determinants? And the third one is the social, educational, and culture dimension. And it says how important it is to respect the local culture, how important it is to listen to them, not just to do a diagnosis, but also to involve them in the solution and the implementation and systematization of the solutions. I'm almost finishing, but I really want to mention how important it is to have the maps and how we have been very successful in bringing this visual resource, this visual tool to represent what these communities or what these public services or what these youth have in their territory, how they are able to recognize the problems they have, but also the resource, not just financial resource, but what different types of resource that they have in their territory and how they are able to use it. And the map that we are using since 1998 is important to help them to see the solutions and to organize their ideas. So I would like really to present these because we started with a drawing map that we say talking map or speaking map. And nowadays we are working with georeferential maps that we can see online maps and everybody can contribute by including information. So now, to make sense what I said before, we invited two different people that are working with us since almost the beginning. Not the second one because she's very young, but the first one is a community leader that has been working with Cedaps for 25 years. And the second person we invited to be here with us is a young leader that nowadays is working also in Cedaps, but she's still working for her community. So let's take some minutes to listen to their speech.
Well, here's
Bom,
Lucia
aqui
Cabral,
Lúcia Cabral,
participant from the Healthy
participante da
Communities
Rede
Network,
Comunitária
Cedaps.
Falar sobre construção compartilhada
Talking about shared
é falar
construction
sobre
is really about the
realmente esse
community's
poder da
power to
comunidade
participate in community
participar
changes
pelas
in the
mudanças da
favelas, in
comunidade,
the
da
outskirts,
favela, das
and active
periferias.
community participation
E
is
a participação
crucial for
ativa da
promoting
comunidade é
significant changes,
crucial para
right?
promover mudanças significativas, né?
Especially in the realm
Especialmente na
of
área
health,
da
public health.
da saúde pública. O
The
poder
power
da
of the
comunidade
community to
para
affect
fazer
change, the
mudanças,
strength of a
a
united
força
community
de uma
is
comunidade
immense.
unida é imensa. Quando os
When
indivíduos se
individuals organize
organizam e
and work
trabalham
together,
juntos,
they can achieve goals
conseguem
that would
atingir
otherwise be
objetivos que seriam
impossible to
impossíveis de
attain.
alcançar.
Positive outcomes,
Positivos,
right?
né? Por meio de ações
Through collective
coletivas,
actions
como
like awareness
campanhas de
campaigns, peaceful
conscientização,
protests,
protestos
and community
pacíficos
projects,
e
the
projetos
community can
comunitários,
exert
a
pressure on
comunidade pode
public
exercer essa
authorities,
pressão sobre o
right?
poder
Regarding
público,
authorities and
né?
influencing political decisions.
Sobre as autoridades e influenciar decisões políticas. Exemplos
Historical
históricos
examples
influenciam,
include civil rights
incluem,
movements,
assim,
public health
movimentos de
campaigns,
direitos
such as the
civis,
fight against smoking,
campanhas de
and the
saúde
establishment of the
pública, como a
SUS,
luta contra o
right?
tabagismo,
Which is
também a
health
conquista do
for
SUS,
all.
né? Que é uma saúde para todos.
Local
As
initiatives to
iniciativas
improve
locais
urban
para
infrastructure
melhorar a
as
infraestrutura
well.
urbana também.
When the community comes
comunidade,
together,
quando se
it creates
une, ela cria
strength and
forças e
amplifies its
amplia a
voice
sua
and
voz
empowers
e
itself in its
capacita
capacity for
na
action,
capacidade
becoming
de
a
ação,
powerful agent of social
tornando
change
agente
with
poderoso
its
de mudança
participation,
social,
of course.
com sua participação, claro.
The
A
necessity
necessidade
of
da
community
participação da
participation
comunidade
in
na
developing
elaboração de
public
políticas
health
públicas de
policies,
saúde,
including the
a
community in the
inclusão da
process of
comunidade no
developing
processo
public
de
health
elaboração
policies,
de
is
políticas
essential
públicas de
to ensuring
saúde
that
é
policies are
essencial
effective
para garantir
and meet the
que as
real
políticas
needs of
sejam
our
eficazes e
population.
atendam às necessidades reais da nossa população.
Community participation promotes transparency, responsibility, and legitimacy in political decisions.
Além disso,
Furthermore,
a gente também,
communities
né,
also possess
com as
unique
comunidades
knowledge
possuem
about their own
conhecimentos
needs
únicos
and
sobre as suas
challenges,
próprias
which can shape
necessidades
more
e
effective and
desafios que
sustainable
podem formar
policies.
políticas mais eficazes e sustentáveis.
Participation mechanisms can include public consultations, advisory committees, councils, community partnerships between governments, and non-governmental organizations.
Não governamentais.
Engagement not only improves the quality of health policies, but also strengthens trust between the population and government, promotes community participation, and values the power of unity, all fundamental parts of creating a fairer and more equitable society.
Uma sociedade mais justa, né? E equitativa.
This is the power of participation, the power of voting, the power of community involvement. This is how we, by participating, build pathways for health promotion and prevention.
Participando, constrói caminhos de promoção e prevenção de saúde. Então,
so never speak about us without us. We always want to be involved in shaping public policy, which is why shared construction at Cedaps is an approach that yields results.
Que tem resultados.
We have achieved many results, and I have personally learned a lot about engaging with public authorities through shared construction. This is a path that introduces the power of participation in the favelas, the power of listening, and the struggle of resistance that we have had over the years, especially in building public health policy.
Na construção da política de saúde pública.
Thank you.
Obrigada.
The community has a great strength in cooperation and solidarity, generating movements from hardships, organizations, projects, associations, and other community initiatives. These efforts amplify this strength by carrying out actions aimed at improving the quality of life for those who live there, from donations to training and sharing information about rights and health. It's a networked effort, from the community to the community. Where I live, in Prazeres, there is a community garden that represents a significant change, run by residents of the area and making a difference within the community by helping to combat hunger, which is monumental. Alleviating hunger is the first step in ensuring people have the energy for a more dignified and active life.
So I would like once again to thank to Dr. Smith, to AAKP, and to George Washington University for having me here. It was such a pleasure to be with all of you. Thank you.
Thank you all for that wonderful presentation and for sharing the work you are doing in Brazil. It was truly eye-opening to hear about the innovative approaches being taken to address community health issues.